Greetings and thank you for joining me for today's Innovations in Facial Plastic Surgery Update. I'm Dr. DJ Verrett. Today I'd like to briefly talk to you about scar revision. Unfortunately, any time that the skin is broken, a scar will be formed. Fortunately, physicians, especially those trained in plastic surgery techniques, will know where to make a scar so that it's hidden. The best places to make a scar are in areas where there are natural skin creases, often referred to as relaxed skin tension lines. These are best demonstrated as the areas where wrinkles will naturally develop. In these areas, even though there may be a scar, it will look like a natural wrinkle and not be obvious. Unfortunately, objects which make scars due to trauma will not know where to make these incisions. Scars will be often visible and can often be disturbing, especially if they're on the face. There are many options, though, for scar revision depending on the type of scar, the location, and exactly what is most visible about the scar. For instance, straight scars are probably the most visible. The eye is drawn to straight lines. If you can take that scar, though, and either reorient it in a natural relaxed skin tension line so that it looks like a wrinkle, or create a jagged scar, oftentimes this will help to hide the scar. Several techniques can be used, including the Z-plasty technique, the W-plasty technique, or the geometric broken line closure. In all of these, the scar is excised and a new scar is created which does not have the straight line or is slightly reoriented to a natural skin crease. Other options for scar revision including removing redness. Scars will be red for a time period. Eventually this does go away, but the process can be expedited by using certain types of lasers. These procedures can be done in an outpatient setting and often with very minimal downtime. By reducing the redness, a lot of times scars will become much less visible. Scars which are raised or scars which have an irregular shape can often be dermabrated or have some other technique of skin resurfacing performed which can help to hide the scar. Firm scars can often be reduced using different laser techniques and resurfacing, and in addition adding possibly steroid injections to the scar itself to hopefully bring down some of the swelling. Special types of scars can exist, including hypertrophic scars and keloids, which are covered in separate topics. Other options for scar revision include excising the scar, especially in cases where there may be a widened scar. Sometimes if the deeper layers of skin are not reapproximated correctly, or if there is additional scar formation in the deeper layers, the top layer of skin can produce a widened scar. At times this will have to be excised and the scar recreated in a more natural way by reapproximating each one of the levels of tissue to create a less wide scar. For more information about scar revision, please visit my website at www.innovationsfps.com or call for a consultation 972-608-0100. Thank you so much for joining me. Have a great day.